Y'all killing me. Y'all are killing me. If you are new to dialysis, if you are a new PCT, okay, a new tech in dialysis, remember, and this is not for the nurses, this is for the patient care technicians. If you got hired as a patient care technician, remember, you have 18 months, okay? You got 18 months, okay, for you to be able to get your certification within that amount of time, either with Bonnet, CHT, or with NNCC, your CCHT. You got 18 months. Technically, you only got really 12 months, because if you new to the field, they won't let you take your test until you have at least 6 months or 6,000 hours. No, 6 months or 1,000 hours of working time on the floor to get that experience. So technically, you only got really 12 months. So you really can't wait till the last minute to take your test or apply to take your test. Please, guys, go. Don't wait till the last minute to do so. I can't tell you how many people I've seen that can't work no more because they don't have their certification. If you give yourself that time, if you apply early, you give yourself that time. You give yourself more time to retake the test if you fail it, and then also too, like, remember, if it's DaVita or Fresenius, these jobs, like when you new to it, they give you on the job training. That usually takes about 3 months, 3 to 6 months, for some people. So right after that training, you should be already applying to take your test, because most of the stuff that they are teaching during that training is stuff that's going to be on the bonnet or going to be on the CCHT test. So please, y'all, I be wanting to just shake y'all sometimes, like, because I know for some of you guys it's a confidence thing too, but you gotta give yourself some credit. You gotta give yourself some credit. Like, this isn't the hardest thing. I'm sure this isn't the hardest thing that you've done in your life. I'm sure you got people who are single parents, right? Single parents coming to work, making a livelihood for the people that they love, for their kids and everything, working almost 50 to 60 hours a week and doing that, right, every week. That's hard, right? You got people that sick themselves, right? I've worked with a couple people that like are in kidney failure themselves, and you won't be able to tell it because they're not the type of people to go out there and tell their business. And they are working hard, taking care of patients. That's hard. You got people that are fighting addictions, and been sober for so many amount of years, and coming and working in the healthcare field and taking care of their patients. Day by day, they have to do that fight. That's hard, right? But these raggedy pieces, these raggedy questions on this piece of paper, that's not hard. You can do this. Give yourself some credit. Give yourself some have that confidence. If you go in there preparing to fail, you're going to fail. But if you go in there with that confidence, go in there with your head high, you are going to pass this test. Trust me, you're going to pass this test. You are smart. All right? You are smart. You've been in the field for this, for you've lasted more than 6 months. So if you was going to walk out, you would have been walked out. Right? The things that you're doing every day, and if you're doing it policy and procedure wise, right? The things that you're doing every day are going to be things that's going to be on the test. So you got this. All right? You got this, man. Don't go in there planning to fail. Don't tell yourself that you're going to be failing. No. You got this. Okay? You got this.